Hey there, my name is Lucy and I work at Women's Health Tasmania. And Joe, who you'll hear on this podcast, wanted me to provide an update to this episode because while a lot of the information is still current, some of what Joe and Dr. Sue talk about has changed. And I am happy to say that it has changed for the better. The first thing to say is that it is now easier to find up-to-date information about where you can go to access an abortion. So there's a new website. It's called Pregnancy Choices Tasmania. It should come up if you just Google the words Pregnancy Choices Tasmania or Abortion Tasmania. It shows which GPs provide abortion care in Tasmania and how you get in to see them. So on this website, there is an interactive map that shows, nearest GP who can help you access an abortion, but it also shows things like pharmacists, imaging, pathology, basically all the people or places you might need to go if you went down the path of getting an abortion. And it's also got information about GPs and pharmacists who can help you if you want to use particular kinds of contraception. The other really big change is that in 2021, the Tasmanian state government made the pathways to accessing surgical abortion in Tasmania easier. The main change was that 3 public hospitals in Tasmania now provide surgical terminations of pregnancy. You will still need a GP referral to access this, so if you're considering an abortion, always see a GP as your first port of call. I strongly recommend heading over to the Pregnancy Choices Tasmania website. Bookmark it, tell your mates about it, cruise around and check out the information that's on it. We'll put a link to the website in the show notes. And as always, if you want to say good day to us over here at Women's Health Tasmania or you have a question, please get in touch. Because that's what we're here for, to provide accurate, evidence-based, non-biased information about women's health and abortion access in Tasmania. Last of all, if you're pregnant and you're considering your options, know that you don't have to do it alone. Women's Health Tasmania is a pro-choice, confidential, free service that's here for anyone in Lutruwita, Tasmania who's pregnant and considering their options. Okay, I'm going to get off my soapbox now and let you listen to this very excellent episode of She's Out There, where Joe and Dr. Sue explain what a medication termination is, what a surgical termination is, and what women say about them.
Hello, I'm Jo Flanagan and I'm the CEO of Women's Health Tasmania. Welcome to an episode of She's Out There, a podcast series on women's health. This podcast is good for any woman in Australia, but it's really helpful if you live in Tasmania. There are resources to go with today's podcast available on our website. So I'm sitting in the work car, which if you follow this series you'll know is our mobile recording studio, and I'm joined here with Sue Mallett, who is my general practitioner. And if you remember Dr. Dolly from the 1970s, we're turning Sue into Dr. Sue for the purposes of this series. So welcome, Dr. Sue.
Thank you very much.
So today we wanted to talk about the termination of pregnancy. What's happening in Tasmania? It's been a very contentious issue here, hasn't it?
It certainly has, yep.
We thought it might be good to start by talking about what is the recent history of terminations in Tasmania. So that's, you have been at the coalface, really.
Yeah, it's been a great irony that Tasmania has been quite progressive in our law in that it's decriminalised, but actually women accessing termination has been so difficult and continues to be quite difficult for many of our women. So by decriminalised, that means that it's a woman's decision what she does with a pregnancy. She doesn't have to gain permission from a partner, a society, a doctor. It's her choice about what she wants to do with that particular pregnancy.
So the bill that took terminations or abortions out of the criminal code is the Access to Terminations Bill 2014.
Yep.
And as you say, her right to access termination services is embedded in that legislation. Yeah. That's one of the important things. But there's a couple of other important things too, isn't there? That one is that doctors, of course, have the right to be conscientious objectors, but if they are, they need to give women information about 4 services in particular where they can go to get more information.
That's right. They have a legal obligation to refer people in a timely fashion to services where women can access the support that they want to do to terminate a pregnancy if that's what they choose to do.
So those 4, they're called prescribed providers, which is a bit hard to remember, and really it's probably easier to just remember the organisations. One's Family Planning, and one is Women's Health Tasmania, and one is The Link, and one is Pulse. They're both southern services, but Family Planning has a good presence around Tasmania.
Yes, we've got clinics in Burnie and Launceston and Glenorchy. So yes, women can go to any of those services. Sometimes if women go to Women's Health Tas or to Pulse or Link, then they still need to see a doctor at some point. And that we were talking about that before, it's slightly tricky. It's not that the doctor gets to say whether you can have a termination or not. It's that you need to generally have some tests done and you need to have a referral in order for you to be able to see a specialist.
Yes. So it's just important to have in your mind it's a referral for a medical procedure.
Yeah.
It's not that this doctor is in control of your decision making.
Absolutely. Yeah.
So, I guess we just touched on the fact that the legislation uses the word termination. And I guess it's the word we tend to use, isn't it? But a lot of people would use the word abortion.
Absolutely, and there's absolutely no difference between abortion and termination.
No.
It's whatever people feel most comfortable using.
Yeah. So, Sue, can you talk us through the difference between a medical termination and a surgical termination?
So a medical termination involves taking 2 medications and that can be done in a pregnancy up to 63 days gestation. So we date a pregnancy from the first day of the last menstrual period. So it's something to be aware of because sometimes people think that they've got 2 weeks up their sleeve and they're actually a little bit further on according to the dating that we're using. So medication termination involves taking 2 lots of medication that causes a medication abortion, so a medicated miscarriage. And a surgical termination involves having a surgical procedure, so an anaesthetic and then a surgical abortion, and that can be done up to 16 weeks of pregnancy.
Okay. And could you talk us through what's involved?
With a medication termination?
Yeah.
So with a medication termination, generally you need to see somebody for an assessment appointment, and at that appointment the doctor or nurse will talk to you about what's involved. They'll also do some tests because it's very important to make sure that it is safe for a woman to have a medication termination. So we need to organise an ultrasound scan to make sure that that pregnancy is actually in the uterus and it's not an ectopic or a tubal pregnancy. We'll need to do some blood tests and we need to do some swabs to look for infection. By infection, I don't necessarily mean an STI. You know how it's normal for us to have bacteria in the vagina. Most of the time they don't cause a problem, but sometimes if you've got certain bacteria, they can cause a problem if somebody's having an abortion. And then you would see somebody for a medication and you are given the medication. Most people take it at home. The first lot of medicine is it's really the point of no return, because once you've taken that medicine you must go on to complete the medication termination, because we don't know what the effects are on a continuing pregnancy of that medication. That medicine generally doesn't make people feel unwell. You can get a bit of nausea and you can get a bit of spotting with it. And then the next medicine you take 36 hours later is the medicine that causes the uterus to contract and expel the products in the lining. And that medicine is always associated with pain and bleeding. And the pain and the bleeding is really difficult to be precise about it. Some women say that the pain is about 8 out of 10. Some women say that the pain is about 2 out of 10. And again with the bleeding can be heavier than a period and go on for 4 or 5 days, or for some women it can be very intense for about an hour or so. And it's quite normal to pass clots, and the clots can be up to the size of a small lime. And that is because the lining is shedding very, very quickly, and so clots are forming before the uterus has had a chance to contract and expel the blood there. quite normal to feel a bit hot and cold and shivering, a bit unwell on the day when you take the second lot of medicine, but usually within about 6 hours people feel a whole heap better. Then it's really important to have a follow-up blood test done. So the only way that you know that a medication termination has worked is to compare hormone levels just before you take the medication and about 10 days afterwards. And you're looking for a significant drop. You can't rely on the amount of bleeding to say, oh, well, that must have worked. With a surgical termination, most of the time you're going to have a scan. You'll generally have a blood test done and you may have some swabs taken. And then you have an anaesthetic so that you are not awake during the procedure, and there is likely to be a little bit of bleeding after the procedure and a little bit of crampy pain.
So, in your experience, what's it like for women?
Look, they did a great big study of women who had medication terminations and said, look, if you had to do that again, would you do it? And about 85% of women said, yes, I would do that again if I had to. And then they asked another question, which I think is probably the more telling, and it said to them, look, if you had a girlfriend who was in a similar situation, would you recommend that they took the medication? And about 90% of women said, I would tell my girlfriend to do that, it's okay. And my experience is that women find that it is difficult but manageable. It is really normal to feel a little bit scared before you go into something, because you don't know when the bleeding is going to happen and how significant the pain is going to be. A lot of places will give you pre-med medication, so at family planning we will get you to take some painkillers and some anti-nausea medicine about an hour before you take the second lot of medicine. And it's really important to be somewhere where you have close access to a toilet and some privacy, and that you have somebody who can stay with you on the day when you take that medication. They can help you by bringing you wheat packs and hot water bottles and food and drink, and just be with you during that day. There is always a 24-hour hotline that people can talk to, and most GPs, and certainly at family planning, we give people very extensive instructions about when is this outside of the normal range of experience and when you should do something about it and what you should do. So we would give people a letter so that if they had to go through to the hospital, they've got a letter there that explains to people exactly what's happened.
So the 24-hour helpline is the family planning helpline?
No, it's a Murray Stopes. Murray Stopes are the makers of the medication. So it's RU486, which a lot of people are familiar with, and so they have a 24-hour nurse line that you can talk to. At family planning, we are open to 9 to 5 Monday to Friday, and we strongly encourage women to contact us if they've got questions during weekdays.
So it certainly sounds like having a good support person is an important part of it too.
It's a critical part. Again, at family planning, we won't go ahead with a medication termination unless we know that somebody's got a support person. Serious complications are really rare, but they can occur, and so somebody needs to be able to access medical care quickly, just in the unlikely case that there is too much bleeding or too much pain.
So if women need to access a medical termination, they can come to family planning, and you have clinics in Burnie, Launceston and Glenorchy and Hobart.
Yes, yep.
There are other GPs?
There are a few GPs around, and we're working hard to try and increase the number of GPs who are comfortable providing that. Murray Stopes does it's called a teleabortion service, and people can contact them online. And then what they do is that they send out an ultrasound request form and pathology forms, so you would go and get the ultrasound and the blood tests, and the results would go back through to Murray Stopes, and then they would contact you again and send the medication out to you. There are a few private gynecologists in Hobart, I think, provide medication termination. It's often quite difficult to find out who is actually providing medication termination, because it does fluctuate a little bit.
It's probably the best way to find out is to call Family Planning or Women's Health Tasmania.
Yeah, I think between us we've probably got the most up-to-date list of who can provide that service.
Yeah. Mm. And in terms of cost, probably the best thing, well, the private providers, it's hard for us to say, but for your cost, the best thing would be to go to your website?
Absolutely, go to the website. It's all there, and there is funding to support eligible women through you guys and through youth health funding if women fulfil certain criteria there.
So Sue's referring to the Women's Health Fund, which is a pot of money that Women's Health Tasmania has to help women who are in financial need to access essential health services. So maybe we should move on to surgical terminations. Yeah, so could you describe for us what's involved with that?
Well, it's generally you need to get a referral from a GP or a doctor at family planning to go to see a surgeon, and then you would often have an ultrasound. You'd definitely have some blood tests, and then you'd be admitted as a day case for a surgical procedure. So that is where you have generally an injection in the back of your hand so that you go off to sleep, and the procedure itself takes about 10 or 15 minutes. Generally you'll stay for about 3 or 4 hours, and then you would be able to go home after that, and you'll generally have some bleeding lasting for a few days and a little bit of crampy pain, like a period pain, lasting for a few days after that.
So this is the form of termination that's been so much in the news, isn't
Yes,
it? So
yes.
it's access to this that is a bit problematic down here in Tasmania.
Yeah.
But one of the things that we've been keen to stress to women is there are some providers in Tasmania.
Yes.
You don't have to go to the mainland. This is not necessarily great news for women in Launceston because they will have to travel to access a surgical termination.
And our experience is that most women in the northwest and the west coast generally have to travel down to Hobart, but it's definitely an option. We hopefully have very few women now who have to travel to the mainland to access a surgical termination.
Unless they wish to.
Unless they choose to, yeah, absolutely.
Reasons. But we would just like to say we understand how difficult that is for folk who have to organise childcare or transport. There is a thing called the Patient Transport Access Scheme, which is funding to assist people with the costs of travel, and it's been adjusted to meet the particular needs of women having to travel to access terminations. So the costs of a person travelling with them is now covered, and a lot of the costs can be prepaid up front, which is a great help.
Which is a huge help, isn't it? Yeah.
So you can contact the contact person at the Patient Transport Access Scheme, and they'll prepay bus tickets or hotel rooms, and if necessary, air tickets. So that's worth knowing, and the contact for that can be got from Family Planning or Women's Health Tasmania too. So the providers for that are mainly in Hobart.
Yes. Yeah.
So in your experience, Sue, what drives women to choose one or the other?
I think some women prefer the idea of a medication termination as feeling like it's a little bit more private and they've got a little bit more control over when the bleeding is likely to occur. So, probably about 50% of the women accessing termination services are in their 20s, so they're often juggling jobs and other childcare needs, and so the ability to be able to control that a little bit better is important. And I'd have to say that for women in the north and northwest, the difficulty accessing a surgical termination drives them to have a medication termination. We, as part of our assessment, always tell people about a surgical option, and it's interesting in Hobart, about half of the women will choose to have a surgical termination, whereas in the north and the northwest, only about 2% of women, because it is so difficult for them to organise childcare or work arrangements to get down to Hobart, and this uncertainty of when they might get a date to have a surgical procedure too makes it very, very difficult for women who are trying to plan and organise their lives.
Yeah, I mean, looking at our stats, most of the women asking for assistance from us are in their 30s, and they've got young children, very young children, so to get away for a couple of days is incredibly difficult, let alone from work.
Absolutely. There's this absolute myth that it's young people who are having unplanned pregnancies who want to have a termination, and it's absolutely not true.
So I guess, was there anything else that we haven't covered that you would like to cover?
Probably only the importance of good ongoing contraception. We know that if women don't have access to good contraception following a termination, they've got a 1 in 7 chance of having a subsequent unplanned pregnancy. And even if a termination is an easy decision for a woman to make, it's often quite a difficult, painful thing for them to do, and I think that it's really important that we try and support women so that they don't have to go through that experience again. So people can become fertile within 2 weeks of having an abortion, so it's really important that they think about having some ongoing contraception if they don't want to have another pregnancy.
So how soon after a termination do you need to start your different contraceptive options, and is it different between surgical terminations and medical terminations?
No, often we would like to start them as soon as possible. So if a woman's having a medication termination and for example their ongoing contraceptive choice might be an Implanon, we actually would put that in before they've actually taken the medication, so that then there's no worry about sometimes people feel they've got to wait for their next period, and we all know that that's when a lot of women get pregnant, when they're waiting for a period to start their contraception. So you can do that at the time of the medication termination, or at the time of surgical termination an Implanon can be put in, or in some cases an IUD can be put in at that time. If we're putting an IUD in following a medication termination, we do that 3 weeks after they've taken the medication. If somebody's going to go onto the pill, we would start that, get them to take a pill the day after they've taken the medication, so that you can make sure that you've got contraception on board before a woman's going to become fertile again.